Hi there, I'm John Vinson, the CEO of the Arkansas Pharmacists Association. I'm here at 417 South Victory in Little Rock at the pharmacy headquarters of Arkansas. I have fourth-year student pharmacist over here, Ethan Powell, student at the Harding College of Pharmacy, spending the month with us. And I also have community health worker and pharmacy technician, certified community health worker, Tara Maltby from Marketplace Pharmacy here in Little Rock. Thank you for joining us, Tara.
Thank you.
Just wanted to give you an update. We had an amazing day yesterday with on the hill across the street at the Arkansas State Capitol. We had over 100 student pharmacists, pharmacy owners, practicing pharmacists from various practice settings, from community, hospital, independent pharmacies, chain pharmacies, nursing homes, visit with over 70 lawmakers from the Capitol. So we had the majority of state lawmakers in our building last night. We were talking to them about two things, and they go hand in hand. One is ARRX Reform Now, the campaign to improve local access, better patient care, and fair prices for Arkansas patients. And we need you to be aware of that, to share information about that. Tara, could you share a little bit about what the experience has been at your pharmacy with ARRXReformNow.com?
Sure. With the other communication that we've been putting out, we've had a lot of patients come in and ask us about what it is, what it means. And then we've also put out the information as far as like signing the petition, things like that as well. So it's been really helpful for us to have an easy way to have that conversation with patients because they're actually coming to us and bringing it up also.
That's awesome. So yeah. Ethan, we worked with Max Caldwell out of Wynn, who was frustrated with misinformation coming in his pharmacy. Yes, yeah. He recorded a radio ad that is going out to 10,000 spots over the next 10 days to try to set the record straight that we are for HB 1150 and we do support a fair playing field where there's not anti-competitive acts where PBMs own pharmacies. That bill was amended yesterday and it's in its current form, so we encourage you to look at it. It does not ban hospitals owning pharmacies. It does not ban Harps or Walmart or Walgreens from owning pharmacies. It does ban CVS. It does potentially ban other PBM-owned pharmacies, about 35 brick and mortar in the state out of almost 800 pharmacies. And it does ban about 90 or 95 mail order infusion pharmacies, but does not ban almost 600 other mail order pharmacies or over 700 local pharmacies who want to be able to service their patients. You want to tell them a little bit about Max's radio ad, why we're excited about it?
Yeah, so we had a really good radio ad with that. Very personable, very on spot with what we were trying to campaign with this bill. Just making sure that you guys are aware of what's going on, what's actually going on here at APA. We're here for you. We're here to advocate for you. We're not taking away your pharmacies. We're trying to make sure that you guys are getting the help that you need in the community. We're making sure that we can do what we can do for you guys. And I think this radio ad makes that, fully transparent with this ad to get to you guys. So yeah.
Now at the very end, Max says his call to action is for patients to come talk to their local pharmacists in their community and ask them what's actually going on, what is the truth, and to visit ARRXReformNow.com to sign the petition. We do have a toolkit on the Arkansas Pharmacists Association website with resources. We've been asked for a paper version of that signing a petition for patients who may not have an email address or they may not be able to use a computer and easily do so. You can collect signatures that way as well with the new downloadable paper form for the petition for ARRX Reform Now. We are at 5,500 currently. We need 10,000. That should be easy to attain if at least 200 of the 730 pharmacies around the state have at least 100 patients each. We'll double that amount. We'll hit 20,000. And wouldn't it be awesome to have 30,000, which is about the number of constituents that a single legislator in the House does represent in the state of Arkansas. So we hope to have you engaged. When patients come in and they're confused, because they might be, there is a smear campaign. The PBMs have unlimited pocketbooks. I saw where one of the largest PBMs stock price was up 12% this morning because they are overcharging when they fill those prescriptions at their own pharmacies, and they are massively underpaying their competitors, the local pharmacists like Marketplace Pharmacy, in an anti-competitive way. With HB 1150, those bad acts identified by the Federal Trade Commission would stop, and they would not be allowed to own pharmacies if they set prices as a PBM. So we're trying to stop the fox from guarding the hen house and bring fair competition back to the citizens of Arkansas. Local access, fair prices, and better healthcare and better patient outcomes are the goal. So rxreformnow.com, engage with the toolkit, engage your patients, and tell the truth. Don't believe the direct-to-consumer text messages that are coming from the PBM industry. Don't believe the billboards that say HB 1150 is bad for rural pharmacy and bad for patient care in Arkansas. That's a false narrative. We support and are for that legislation. We commend and appreciate Representative Jeremiah Moore and Senator Kim Hammer for introducing it. And we're looking forward over the next couple of weeks to get that thing passed. But we're going to need your help. We need signatures on the petition. We need to hear patient stories. And next week, we'll have some additional action items on how to reach out to legislators to ask for support on HB 1150. But for right now, sign up, sign the petition, engage your patients, and thank you very much and have a good day. Happy Valentine's Day.